Hello students, you are watching PharmaQuick, and in this lecture we will be discussing a very important topic, that is hypertension, and we will also be discussing the antihypertensive drug classes. So without much ado, let's start the lecture. We will be discussing hypertension and the role of sympathetic nervous system in controlling blood pressure in our body. When a blood pressure is decreased by any means, it causes certain effects. It causes the decreased renal blood flow that leads to increased secretion of renin, which also causes an increased secretion of angiotensin II. This angiotensin II, when its level increases, it causes an increased level or increased secretion of aldosterone. The decreased renal blood flow, it causes the decreased GFR. The glomerular filtration rate, the normal GFR is 125 ml per minute. When it is decreased, it leads to increased sodium water retention, and this is caused by the increased aldosterone levels. When sodium water retention increased in the body, it causes increased blood volume. Now you have to remember that the blood volume was increased. On the other way around, the sympathetic nervous system causes some other effects in other parts of the body as well. It causes an activation of beta-1 receptors in heart, activation of alpha-1 receptors on smooth muscles, and activation of beta-1 receptors on kidneys. When beta-1 receptors on the heart activates, they cause increased cardiac output. When alpha-1 receptors are activated, they cause increased venous return. And when beta-1 receptors are activated, they cause increased peripheral resistance. So this activation of beta-1 receptors on kidneys causes increased renin production, and you also know that the increased renin production leads to the effects that we have discussed. The angiotensin level increases, aldosterone level increases, and that also leads to increased blood volume. Angiotensin II causes, the increased blood volume that causes increased cardiac output, and angiotensin II levels, they increases peripheral resistance as well. So now the increased cardiac output eventually leads to increased blood pressure. The increased venous return, it causes increased blood pressure, and increased peripheral resistance is also causes increase in blood pressure. So we know that the increase in blood pressure is due to certain factors, and let's count them one by one. That this blood pressure increase is due to activation of beta-1 receptors. So our drug must act here in order to decrease the blood pressure. Alpha-1 receptors, beta-1 receptors on kidneys, angiotensin II, aldosterone, and renin. So these are the spots where our drugs must act in order to decrease blood pressure. So let's categorize and classify the antihypertensive drug classes. Let's divide the antihypertensive drug classes into heart, kidneys, and blood vessels. On heart, the following drug classes: the selective beta-1 blockers, calcium channel blockers, and non-selective adrenergic blockers. On kidneys, there are few drug classes like angiotensin receptor blockers, renin inhibitors, loop diuretics, thiazide diuretics, potassium sparing diuretics, osmotic diuretics, AC inhibitors, and aldosterone receptor blockers. While on blood vessels, alpha-1 blockers, vasodilators, and centrally acting adrenergic drugs. In next lecture series of hypertension, we will be discussing each drug class individually. So, thank you for watching and sharing this video. Subscribe this channel for all the upcoming lectures.